by Katie Scheiding with Christie Clinic, a nurse practitioner in the Department of Obstetrics and Gynecology. And we're talking today about teen pregnancy. And when we look at some of the rates on this, Katie, it may seem like there are a lot of births to teen mothers, but we're actually seeing a record low in that rate for the United States.
We actually are. So in 2013, there were about 26 pregnancies to teens per 1,000 births as compared to 117 per 1,000 births in 1991. So there has been a steady decline in the pregnancy rate.
Okay, and this medically, is this a good thing?
Absolutely, because mothers who have teen pregnancies are at much higher risk as compared to adult women in their 20s and 30s.
And let's go through some of that. So for teenage mothers, we're talking like 15 to 19. Is that the age group?
That is correct, yeah.
Okay, and here are a look at some of those risks. And Gino, just kind of kicking things off, what are some things that teen moms may suffer from with having a pregnancy at such a young age?
Sure, so that would be insufficient prenatal care, high blood pressure, postpartum depression, anemia, premature labor, inadequate weight gain during pregnancy, likely caused by nutritional deficits.
Okay.
There's an increased risk for poverty due to lack of or limited employment opportunities, and it's very difficult for them to complete their education, although I think our school systems have improved their efforts in helping those teen moms to be able to continue their education.
Yeah, we're going to talk to a program that is actually focused on that effort coming up in just a little bit. But what is the #1 concern when you consult with a teenage mother?
So their support systems. So when we look at what is their support systems like, whether that's parent, grandparent, guardian, where are they living, who are they living with, is father of the baby planning to be involved, what is their school like, what are their financial opportunities, and we're partnering with community elements here in town as well, because they do help with the social and financial aspects of teen pregnancies and those risks.
And one of the things you mentioned at the top of the list was insufficient prenatal care. Yeah. What sorts of effects could that have on the mother during the pregnancy?
And so when she doesn't come in for routine prenatal care, when she establishes much later, there are opportunities early in pregnancy to get prenatal vitamins and folic acid on board to prevent neural tube defects, or to make sure that nutritionally she is supported and does have adequate weight gain and growth to make sure that she is supporting the baby.
And it sounds like so many things kind of stem from that main
early
concern.
prenatal care. Absolutely.
Okay, so let's talk a little bit. You mentioned some of the risks that are out there for the babies that have a teenage mother. What are some other things that you worried about when it comes to the health of the child?
Yeah, so whether babies who are born to teenage mothers have a higher risk for premature birth, low birth weight, which can cause inadequate organ development or growth of the baby, and those can have a much higher mortality rate as compared to babies who are born full term or maybe to adult mothers.
Why is it that we worry more about premature birth with a teenage mother?
Because premature birth, like I said, increases the risk for improper organ development, because the longer a woman is pregnant, that's when baby's gaining all of their weight, organs are growing and developing and preparing for the outside world, if you will, where a lot of, during pregnancy, mother is establishing all of that and regulating all of that. When baby is born, they're on their own.
Right, and you also say genetic abnormalities may be something to be concerned about as well.
So we say that the earlier a woman is, as well as the later a woman is in her childbearing years, it does increase the risk for chromosomal abnormalities.
Okay, so it's kind of a window. That's the ideal window.
It is.
Okay.
Sure.
What sorts of counseling do you do with teen mothers that might be different than regular pregnancies that you see?
Teen mothers also have a higher risk. That's a risky age group where they sometimes don't kind of fully understand the consequences of their behavior. So might be at higher risk for alcohol use, tobacco use, drug abuse, or relationally, are they in a good relationship? Is somebody harming them? What are their, again, support systems like to help support them during the pregnancy?
And there have actually been some recent changes and recommendations when it comes to birth control for teenagers.
It has. Traditionally, we always went with maybe the birth control pill, which is our longest form of birth control that's been out there. But what we've seen is if they're not consistent with use, or if they're using it sporadically, certainly the increased risk for pregnancy, because it does have a very short half-life. So it's not something that can be used, sporadically. It has to be taken every day at the same time. So we've switched to maybe some of the longer forms where they do something maybe weekly, monthly, or every 3 months, or yearly, every 3 years. So we've extended that to try to help that consistent coverage to decrease the risk.
Yeah, and then when it comes to your first visit to an OBGYN, what are some recommendations for parents or for teenagers out there themselves who want to start, practicing good health at a young age?
And so we're partnering with family medicine as well as pediatrics to hopefully get those young girls in our office between the age of 13 and 15, not to necessarily push birth control, but talk about menstrual irregularities, growth development, but also if they are either considering being sexually active or already are sexually active, to have that conversation of what methods do we have available to help protect you from an unplanned, unwanted pregnancy.
And finally, if a teenager does have a positive pregnancy test, you want to call the doctor right away.
Absolutely, as early as possible.
Okay.
Yeah.
Thanks so much, Katie, for joining us this morning.
I appreciate it.
Coming up.